my name's Amanda Lindquist. I'm a foster parent and the Northern Rep for the BCFFPA. For today's episode of BC Foster Basics, I would like to talk to you about arranging for babysitters and relief care providers. There have been many misunderstandings about the ministry's expectation for screening and assessment of relief care providers, babysitters, sleepover events, playdates, and other similar needs for caregivers and the children in their care. In May 2013, the Foster Family Handbook and the Caregiver Support Service Standards, which guide MCFD resource workers, were updated to bring clarity and consistency of practice to screening and assessment of care providers in non-primary care situations. Non-primary care refers to individuals who are providing care but who are not MCFD-approved caregivers. Make sure you have the updated 5th edition of the Foster Family Handbook to follow the changes. The handbook is available at the Ministry's website and through a link on the BCFFPA website. Who requires screening in order to provide care? Anyone who has significant unsupervised access to foster children will require screening and approval before they can provide care. This includes individuals who are 18 years of age and older who live in the home, individuals age 18 years of age and over who are visiting or staying overnight for more than 30 days in the home where the child lives, anyone in an intimate partner relationship with the prospective or approved caregiver or regular care provider who often visits or stays in the home where the child lives. Significant and unsupervised does not apply to childminders, babysitters, sleepover hosts, or activities outside the home. However, in these situations, the foster parent, in their role as prudent parent, would be assessing the situation to ensure safety for the foster child in their care. When in doubt, foster parents can always obtain advice and support from their resource worker. What is a prudent parent? To act prudently is to exercise good judgment or common sense. Foster caregivers undergo a thorough screening, assessment, and approval process. This being the case, MCFD trusts the caregivers to act appropriately in their role in order to ensure a child's safety and best interest. It is the foster parent's role to ensure that anyone else who is caring for the foster child that they're responsible for possesses the maturity and knowledge, skill, and ability to meet the child's needs and follow through on childcare routines. All temporary caregivers must use behavioral management techniques and appropriate discipline. Foster caregivers must ensure that temporary caregivers know not to employ any physical punishment or other prohibited methods of discipline. Normally, infants and preschoolers remain with their foster parents during the day, but when childcare is required, children should attend licensed childcare services because screening and criminal record checks are already in place. If an unlicensed childcare service is chosen, both the child social worker and the caregiver are responsible for selecting, screening, and monitoring the child's care in this setting. When selecting the appropriate childcare service, use the Parent's Guide to Selecting and Monitoring Childcare in BC. Once a service is selected, the foster parent consults with the child's social worker and their own resource worker. The resource worker completes the criminal record checks and prior contact checks for unlicensed childcare providers. Supported childcare may be available if you're caring for children with disabilities. This was previously called special needs daycare. In this case, discuss childcare subsidy and surcharges payments with your resource worker. Acting as a prudent parent, foster caregivers are also responsible for approving all significant and unsupervised situations involving casual visitors and the child's outside activities such as playdates, sleepovers, and tutoring. Please refer to page 49 of the Foster Family Handbook for more information on sleepovers. Relief, which is sometimes called respite, is a break from caregiving and is important for both the child in care and the foster parents in most family care homes. Please refer to page 50 of the Foster Family Handbook for more information on this subject. Relief means overnight care that typically lasts between 1 and 3 days. The children are cared for in either the foster parent's home or in the relief care provider's home. Whenever possible, relief should be provided by another approved foster parent. When this isn't possible, the caregiver and social worker work together to assess prospective relief caregivers. The foster parent conducts an assessment by using the assessment guide and checklist. Please refer to page 72 to 78 of the Foster Family Handbook to learn more about the assessment. The social worker completes the screening process, which includes a criminal record check. The care provider assessment guide and checklist contains 6 steps to establish an individual's suitability to provide relief care. Assessment discussions. The foster parent asks a series of questions of the potential caregiver and provides the information to their resource worker. Awareness of foster caregivers' contractual obligations and required standards, policies, and procedures. The foster parent ensures that the relief provider has copies of all applicable reference materials and reviews the necessary standards. Observing the environment of care. The foster parent visits the potential relief provider's home to observe that criteria from the standards for foster homes are met. Child and youth views. The foster parent seeks the child's opinion about the proposed relief caregiver and continues to monitor the child or youth's relationship with the relief caregiver. 3 acknowledgements. The relief care provider signs agreeing to standards, policies, and procedures that have been reviewed. The foster parent signs that they have followed the necessary steps of the assessment. The foster parent again signs a recommendation that the individual become their relief care provider. Information sharing. The foster parent signs a ministry form to confirm that each time a child receives relief care, they have shared the necessary information about the child's needs and circumstances. I hope you've enjoyed this segment of BC Foster Basics. If you need further information or assistance regarding babysitting and relief or any other fostering subject, please call us at 1-800-663-9999 or check out our website at bcfosterparents.ca. Also, please don't forget to visit the BCFFPA YouTube channel regularly for more topics in the BC Foster Basics series. Topics such as understanding your contract and many more.